Hello everyone, welcome to my channel. From today onwards, I will be starting a complete surgery training series. I am CPC Certified Medical Coder, and in this series, we will cover surgical procedures step, including the anatomy, technique, and coding guidance. This will be very helpful for students and professionals. Let's begin. So, what do you mean by surgery coding? In surgery coding, assigning the CPT codes, like a current procedural terminology code from 10,000 series to 60,000 series for surgical procedures performed by doctor. There are different six sections present in surgery coding, and they are having the code range. Like for the integumentary system, 10,000 series, musculoskeletal system, 20,000 series, respiratory and cardiovascular and respiratory system, that is an 30,000 series, digestive system, that's an 40,000 series, and urinary system, that is 50,000, endocrine and nervous system, that is 60,000 series. So before starting the all the things, we have to understand the basic terms in the surgery coding. And these basic terms, like what are the surgical actions? While we are coding the live charts, we have to understand these terms. We need to understand these terms very clearly. We have to know this. Okay. So there are different surgical actions. You can see here. There are also some different actions, but I'm just giving an example. Like these are the surgical action. What that is an incision, excision, resection, extraction, destruction. Second one is repair and the reconstruction. Repair, reconstruction, revision. What is a closure? That is a simple, intermediate, and complex. Surgical approaches. While in the going to live chart, we have to understand that what is surgical approaches, like open, closed, percutaneous, endoscopic, laparoscopic. Now biopsy terms like incisional, excisional, common medical terms, we have to know that what is lesion, mass, tumor, abscess, and cyst. Fractures, transplant and graft, surgical package, what is surgical package, pre, intra, and post-operative and global period. Important terms like bundling, unbundling, modifiers, add-on codes, laterality like RT, 50, etc. And other terms like debridement, drainage, exploration, addition, and fusion. So one by one, we will see that what these terms are. So first one, that is incision. There is surgical action. So that incision means simply a cutting into a body. If there is a abscess drainage, example abscess drainage, it means if a patient body having the abscess, so fluid filled in that abscess, so this should be drained out, this should be pulled out, this should be cut. So physician will first make and cut into the body, then remove that fluid, that collect that fluid. So this is simply an cutting into the body. Incision means simply cutting into the body. Second one, that is excision. Excision means removal of a part of tissue or a part of organ. If something, a part of tissue or part of organ is removed, it means that is the excision. For example, cyst. You can see here, patient body having the cyst here. So this cyst has to be removed. So this skin part has been removed. So that removal of the part of tissue, that is known as excision. Now, resection. Resection means completely removal of the organ. Entire organ should be removed. For example, appendix removal. If a patient is coming for removal of appendix, it means appendix is something organ in our body. So that complete organ should be removed. That is an resection. That is an removal of entire organ. That is an resection. Some another example, if a patient having an kidney kidney issue, okay, there's a problem in an kidney. So if the entire kidney has been removed, that is resection. Okay, removal of entire body or entire organ. That is a resection. Coming to extraction. Extraction means pulling out. That's for example, nail removal, tooth removal, nail and tooth removal, pulling out. It means something using a scalpel, blade, nail cutter. The uh, physician or some, if there is some issue in our nail, physician will pull out that. If there is, and something nail cutter, like a nail removal, that is an extraction, pulling out something from our body part. That is an that is an extraction. Now, next one, destruction. Destruction means destroying tissue without removing that part. Okay. Using some laser therapy, using some cryotherapy. It means destroying. Destroying means no any part of that infection infected. For example, if there is if patient having an skin problem, okay, something like what is there, okay, so that what has been removed using an laser, not that area has been removed, only that part is removed using an laser, not tissue has been removed. Destroying the tissue but not that part is removing, only destruction using a laser. For example, if patient using an cold therapy like cryotherapy, physician will not making any cut or removing that something part. He will use something another object to destroy that tissue. That one is destruction. Okay. Coming to next, that is an repair. Repair means simply fixing the damaged tissue. For example, a patient having an wound. Okay. So that wound has to be closed. So that wound has to be repaired. So physician will use something, suture, using some gauze material. So fix that damaged tissue. Physician will use something closer of the skin. Okay. So that is repair. And coming to next section, we will see that what type of repair is. How it will be closed, how we understand that simple repair or intermediate repair. We'll see that in the next coming. But repair means something that is fixing that damaged tissue in order to prevent the skin infection. Okay. Now coming to next, that is an reconstruction. Reconstruction means simply restoring the structures. For example, physician will patient is coming for a cosmetic procedure. For example, he is coming for the plastic surgery of her face, of her face structure. That is it, before surgery what she looks like, and after surgery you can see here. After surgery, the face structure has been changed. So that one is reconstruction, plastic surgery. Okay, restoring the structure. Now, coming to next, that is revision. So, revision is what? Correcting the previous surgery. For example, in previous slides, we see that a patient is coming for the plastic surgery of her face. After plastic surgery, what happens? The if she has something infection in that area, infection in her plastic surgery area, so she will go again to that physician for the correcting that area. That one is known as revision. Now, coming to next, closure. So what I say closure is simply uh, to in order to prevent the infection, wound closure. So wound closure is simply three types: simple closure, intermediate closure, and the complex closure. In simple closure, Physician do single layer closure. Single layer closure involves the skin level, that is an epidermis, dermis or subcutaneous tissue will be involved. Physician use something adhesive glue, sutures or staples. Coming to intermediate repair or intermediate closure, we can say that one layered closure or multiple layer closure, we see that. And skin level is what? Non-muscle fascia and the subcutaneous tissue. So there is a two-layer closure, that is a non-muscle fascia and subcutaneous tissue. Physician will use sutures, retractors, needle holders, or scissor to close that wound. Now, coming to next, that is a complex closure. Complex closure is it means that is an if patient having a wound and their bone part, muscle part, tendon part, or tendon part is visible. Okay, so that one is complex closure. You can see that. And physician will use something stent, hook, or retention, suture retention. Extensive undermining has been used in the complex closure. Now, coming to next, that is an open surgery. Physician will make an big cut into an body. If physician use big cut in an body, big incision, it means open surgery. For example, if open surgery is not written in the in our live chart, like a chart. So what we how we understand that one is open surgery, closed procedure, or open procedure. So if a physician use some words like the big incision has been used, incision, big cut has been used, it means it is an open surgery. Okay. Now coming to next, that is a closed procedure. Closed procedure with it means no incision has been done. Or we can say that very minimal incision, very minimal cut. If it is in closed procedure, no, then the physician will definitely use the if there is no incision, it means it's a closed procedure. If there is an something like very small incision, very minimal incision, minimal cut used, it means it is a closed procedure. Okay. Coming to next, percutaneous. Percutaneous procedure means approaches. These are the approaches. Okay. So percutaneous approaches mean needle puncture. Physician will use some needle puncture in the body. Okay. For example, if we, sometimes the physician use the words like in the charts, we can see that percutaneous word is there. So we can easily understand that is percutaneous. But what if percutaneous is not there written in the chart or procedure? So if percutaneous word is not there, then we will have to understand that if needle puncture is there, then it is percutaneous procedure. Now, endoscopic. Endoscopic means using a scope or having a small camera inserted into the body to see inside the patient body. Okay, that is an endoscopic. Now, coming to laparoscopic. So, laparo means abdomen. So, on so to examine the abdomen part, a small camera has been there and minimal cut has been used to see inside the abdomen, to examine the abdomen. Okay? To examine the abdomen, if a small camera or scope has been inserted in the patient body by having the minimal cut, that is a laparoscopic procedure or approaches we can see. Okay? Now, coming to next, that is an incisional biopsy, excisional biopsy. So, incisional biopsy means diseased part is removed to examine the disease. Only for the analysis of the disease. Only for the disease examination, only for the diagnostic procedure, we can say that That is an incisional. But excisional biopsy, it may be diagnostic or therapeutic. It means entire part has been removed from the body. That may be for the diagnostic or the therapeutic procedure also. If there is something, cyst has been there in our body, then it should be completely removed, entire part has been removed. That is an excisional biopsy. And biopsy word is there, it means something. If that part is sent for the laboratory purpose to check the diagnosis, to examine the disease, which type of disease is there, to check the cancerous is there or not. Okay, so that one is excisional biopsy. Coming to lesion. Lesion means abnormal tissue in a body. Okay. Mass means abnormal growth or swelling that is called as mass. Tumor, that is an abnormal growth which may be benign or malignant. So benign means non-cancerous and malignant means cancerous. Okay, so that is abnormal growth is known as tumor. Abscess means collection of the pus. That is an abscess. Next graft. So, what do you mean by graft? Graft means transferring the tissue from one part of the body to the another part of the body of the patient. It may be autograft, allograft, or xenograft, or something another also graft is there. But simply, you can say that auto means if the patient is transferring the tissue of the part of the body to another part of the same patient. For example, here is an if patient having an that tissue that is affected area, so that should need an grafting. So the physician will take some body part from their lip and he will insert there that area. That is an autograft. Okay. Now coming to allograft. Allograft means grafting from the another patient. Okay. Xeno means another species. Species. Transferring the tissue from another species. To understand the graft, we have to also know that what is flap. What do you mean by flap? It means transferring the tissue with its blood supply. What is the blood supply? It means it is also a graft, but the transferring the tissue from one part to another part by maintaining the blood supply, it means there is some connection between the donor area and the recipient area. And in the graft, what is the difference? There is no connection between the recipient area and the donor area. Okay, that is the main difference in the flap and the graph. To understand the graph, we should have to understand that what is flap. Okay, so there will be some connection. There will be some blood supply, maintaining the blood supply. Okay, and graft not maintaining the blood supply. That's only the grafting, not anastomosis. Okay, there is no connection between the one part or the another part of their body. That is a graft. In flap, there is a connection. Next slide. That is on surgical packages. What is pre-operative care? Before the surgery, what the physician will prepare, that is known as pre-operative. Pre means before, operative, before surgery care. What the physician will perform, that is known as the pre-operative care. Intraoperative care means during surgery, what the physician do is known as intraoperative care. Post-operative care means after the surgery, if physician is doing something that is known as post-operative care. And the global packages, that is the time covered in the packages, time covered between the pre, intra and the post-operative, that is a global package. Okay. Now coming to bundling. Bundling And unbundling, we have to understand that simply in the medical billing, for the financial impact, that bundling and bundling will be maintained. We have to check. Okay, bundling means multiple services included in one CPT code. That is unbundling. It means there is a fixed amount. And unbundling means separating the incorrectly, not allowed, more bill will be there. And financial impact in the medical billing. Insurance will not claim that. Denial will come. Okay. Now, coming to modifiers. Modifiers simply two-digit alphanumeric and numeric character which is appended to CPT procedure to give the extra information regarding the services provided. That is an, for example, 22 RT. I will show you in the CPT books. So, for example, that is a modifier. Modifier 22. What is this? This is an increased procedural services. For example, if physician is doing some procedures like that, I will show you some codes like a physician is doing some procedure there, like coagulation of prostate, some procedure like this service that is in code 52647. Okay, this procedure is doing. If this procedure is doing and physician decided to do it in half an hour, but if that extra time needed, then this will be, we have to append a 22 modifier. Increased procedural services. I'm just giving for that I'm just giving example how modifier to append that procedure. Okay. So extra information, but not affecting the part. Okay. But not affecting that code. Okay. Now coming to add-on code. Add-on code, what is add-on code? How we know that what there's an add-on code, extra procedure code. For example, I'll show you what is an add-on code. Wait, there is a plus sign before some codes. Okay, you can see here. For example, this one is an add-on code. How we know that that is an add-on code? Because the plus sign before that procedure code or that service. So, and the rule is that we should not give singly that code. We have to append the main code before that. So, what is the main code? Main code is 2284. If extra something needs, we have to add that one code, additional procedure. It means add-on code means additional procedure has been used. Okay, that one is add-on code. Coming to next, that is an debridement. So what do you mean by debridement? Debridement means removing the dead tissue, removing the necrotic tissue from the body. If there is some issue, if there is some problem, if there is a wound, and remove that wound, remove that dead tissue, that is an debridement. Removal of the dead tissue is a medical term. We should know that debridement. Coming to next, that is an drainage. Drainage means removing the fluid part or pus. Removing the fluid. Drainage means we have to understand that fluid part has been removed. Now exploration. Exploration means checking inside the body. Explore. Okay. Lysis of adhesion. So lysis of adhesion is nothing but a breakdown of the internal scar tissue called the adhesion. So that part has been removed. To remove that scar that cause organs or tissue abnormally stick together. That is an removing. Okay. Now fusion. In the musculoskeletal system, we will see that what a fusion is. That is an joining of bones. For what purpose? For the pain management, okay, for the stiffness of the joint, okay. So that should be bone joining, that is an fusion. Coming to next, that is an cyst. Cyst is nothing that is a fluid filled sac. So, so the fluid filled sac should be removed. Incision and drainage will be done. Now next that is an closed fracture. Closed, what do you mean by fracture? Fracture means breakage in the bone. So breakage in the bone, so it should be closed. So closed fracture means bone is not exposed. So if the bone is not exposed, how should be this procedure performed? How should be the closed procedure, closed fracture repair should be performed? Using in some cast or splint. Closed fracture bone is not exposed. Some exercises have been used that is in closed fracture. Open fracture bone is exposed. We can see with the naked eye, that is an open fracture. Reduction. Reduction means fixing the bone position using an splint or cast. That is an reduction. Now internal fixation. Internal fixation means fixing the bone using a plate or rose. Okay, so that one is the end of the basic term. In the upcoming part, we'll see the what the procedures is used in the live coding and how it should be navigated, what are the code, what are the diagnosis performed, what are the ICD we append. We'll see all this. So thank you. So please like and subscribe my channel.